Whenever I look at television, it's always
Yeah.
very painful. Hi, I am Dr. Ting Ting from the National University Heart Centre, Singapore. I'm a consultant cardiologist and I have two special friends with me today for tea. And maybe Evelyn, you would like to introduce yourself?
Sure. Thank you for inviting us, Dr. Low. Now, I'm Evelyn Tan and I'm a mother of four and I am a local celebrity.
My name is Biwa Hua Jie, a retired member of parliament. Many people like to ask me, women's heart very special, meh? You need to have this extra name and title to that center. So that's exactly what we're going to address about today. As you can tell, we're all ladies right here and we're going to discuss matters of the heart.
Right. You know, it's true that I was quite curious. Why is it that we need to be so specific about addressing women's heart issues? You know, do women really need to take care of their heart more so than men?
Okay, I wouldn't say that women have to take care of their hearts more than men, but we find that women are not doing enough for themselves or not knowing enough that heart disease matters. Why don't you tell me, you're knowledgeable, you walked the ground before, you tell me, what do you think is the top killer of women in Singapore?
Well, I guess.
Would have thought you.
Must be the heart disease.
Oh, you're so clever.
Yeah, because of the way you asked.
I give chance.
I was going to go along with, ovarian cancer or, maybe breast cancer, maybe?
Yeah, so actually that's exactly where the myth is. Most women, they worry about breast cancer, ovarian cancer, cancer associated with reproductive organs that men don't have. But actually, cardiovascular disease, heart disease, circulatory disease is the top killer of women in Singapore. It's so common that, like among three of us here, one of us is going to die from cardiovascular disease at the end.
The rates are so high.
Yes, 1 in 3.
Wow.
1 in 3.
And why is that so? Can you explain?
Well, it is the most common chronic disease and it actually involves a big spectrum of disorders. So when I say cardiovascular disease, I mean not just heart disease, but also anything associated with the pump and circulatory system as well as brain. So we're talking about heart attacks, strokes, heart failure, high blood pressure, heart valve disease, heart muscle disorders. So all of this put together, they are the top killer of women.
You're very chim.
Very chill. I was going to ask something, is it because our kids make us get sick? That's why?
No, I think the main reason is that we women, we are very good in taking care of other people. So much so that we neglect about our own health.
So I'll tell you a story of this lady who came to see me recently.
Okay.
She came to me saying that she's concerned with her high cholesterol. And then I was like, how long have you known it? And she said, I decided to see you as a heart doctor for the first time after knowing it for almost 8 years. I said, what takes you so long? And she says, actually it runs in my family. Even my children have high cholesterol and I've got them to see a pediatrician and have high cholesterol medicine started. But for myself, I just thought I'd wait and see.
But now that you talk about it, that reminded me. Recently, I did have kind of a health scare. I was feeling numbness on my left arm. So then, the doctors was asking me, this is a sign of stroke. Do you have high blood pressure and all that? I'm like, I don't really know. So yeah, I think maybe I should start.
Then what happened after that?
So thankfully, it was just more like, I think I was going through a lot at that point in time. But thankfully, I was able to be discharged after one night stay to the hospital. Yeah.
But you know what you just said just now, like you decide that I probably is quite emotionally strained this time.
Yeah.
I think a lot of women take that as a reason for not seeking consult when they feel unwell. So we do see that women with heart disease, they do tend to present to hospital later and they can tell you that when they have symptoms, I thought I was just a bit stressed. I just needed to rest more. I'm taking care of so many other things anyway. So we find that they're not presenting themselves to the hospital and advocating for themselves when they feel unwell.
Because women, we always take care of others first, ourselves last.
We have no time for ourselves, in that sense.
Correct. Whenever you have good, delicious food, right? You keep it for your family members. You eat last.
Yes.
That is our
Our strength.
Our strength.
Yeah, that's something that is very admirable about women, because I think we embody beauty, and part of sacrificing, personifies that beauty, right, in us. Yeah. But you see, the thing is, even the airlines say it, we have to look after ourselves first before we can look after others. So, okay, today we must learn how to take care of ourselves first, yeah?
And you know what's a good thing about this? We find that when we advocate good heart health to the women, they bring back these benefits to the rest of the family. When you tell a woman how much she needs to exercise, to watch diet, to look for risk factors, to get them under control, then the whole family gets healthy together.
Okay.
Yes.
Okay, so it starts from us, huh?
Yeah.
Okay, but what age must we look out for these issues?
Alright.
Does heart issues only start at maybe when you're past 50, maybe past menopause?
So that's a very good question. I mean, if we want to be at the top of the game, then maybe we should just start as early as possible, right? And I think God is fair in some way. They protect women with our female hormones. Actually, before menopause, heart disease doesn't strike us as commonly as men. But once we reach a menopausal age group, or what we call perimenopausal age, then that risk suddenly escalates to as high as men. So we do see in our hospitals that there are not many young women admitted, but when the elderly woman is admitted, they just have so many more problems to sort out than the men who are admitted. And for the young women who have heart disease, they actually have heart disease in a more severe or more deadly form than men do. They're more likely to die from a heart attack than a man of the same age. We really should start taking care of our hearts right from just before perimenopausal age starts out. So I would say 40 would be a good age.
Extra care lah.
Extra
I'm sure before
awareness.
that they have to take care as well, right?
Yeah.
So healthy lifestyle, we always say, starts from childhood,
yeah.
right? But most people start, suddenly becoming more aware around 40 and 50. So that is a good time, I think, to really start, changing lifestyle and modifying it aggressively.
Right.
I think this message have to put across to all Singaporeans, because at the age of 40, all of us at that age very busy with career, busy with family.
So I'm getting a little bit worried here because I'm probably in the perimenopausal stage right now. So in like a couple of years' time, I'm going to hit the big 50 and I'm going to be half a century old. So I should start getting worried.
The only thing is you cannot wait until you feel unwell to check for your heart.
Okay.
Or to check for the risk factors that can affect your heart. So it's good that you're feeling healthy and you are having a healthy lifestyle, but it would be good to also screen for some of the risk factors which will otherwise be asymptomatic until a heart attack occurs, or until a stroke occurs.
Okay.
So is there any national program helping those Singaporeans in that age group to screen their hearts?
Yeah. I think we are all in this movement now, right? For healthier SG. So we are really, not containing our health messages to within the hospital. When people are sick, then you come in and I tell you how to take care of your hearts. Now we are moving out. That's why I got you here and got you here. We want people to listen in, even when you're healthy, to know that there are active steps you can take to keep healthy, to screen and start a healthy lifestyle right from beginning.
Actually, I was quite interested to come on board this program because since I retire, besides doing what I need to do, I wanted to share with my friends, my family members, how to be healthy and happy.
How long you retire already?
2 years plus already.
2 years. Okay.
Tell us about your retirement
So
life.
I created a chat group called Healthy and Happy.
Okay.
So whenever I wish my friends happy birthday,
Yes.
then I'll invite my friend to come and join me for morning walk.
Okay.
So I think walking is a very good exercise. So now that I retire, I feel that it's good to get my friends to come along with me to share with them how to keep healthy and how to be happy. Yeah, this is why after walking is la kopi.
So I want to check with you, when you check in with your friends, do you talk about specific organ or do you talk about blood tests? You compare, my cholesterol better than yours. Do you do that?
Actually, I think women, we don't do that.
Is it?
Yeah.
Then we're not talking about it often enough.
We don't compare.
Do we
But then
need to? Do we need? Is this important for us to talk about this?
I think it's nice instead of we're comparing clothes when we're younger.
we
is
don't
it? Or-
compare clothes also.
So we do see that menopause comes around 50 for most people.
Okay.
Perimenopause age means from 40 and above. So we like to say 40 to 60 is that perimenopause group.
Right. Okay. So, what are the signs to look out for? How do we know when we step into menopause?
Menopause sets in when we stop our menses for a period of 12 months.
Right.
But it kind of starts to dwindle a little bit before that, and it can vary for different people. However, with menopause setting in, usually there are a few other symptoms that come along the way. A bit more mood swings or irritability. Some people feel some heat intolerance, more palpitations. You may find that blood pressure suddenly goes out of control. And for the reproductive system, some report feeling vaginal dryness and generally just a feeling of irritability.
This one I must ask Dr. Lee now. Have you experienced any of these symptoms?
I wanted to ask doctor, I don't have any symptoms. I
it's
didn't
possible
know that I
too.
went into menopause.
That's a good one.
good.
Maybe
Is it normal? Is it normal?
No, so for those who do not experience any menopause symptoms, that's fine. But it doesn't mean that you have no menopause, right? Because when you have menopause, it means basically your ovaries stop functioning and you don't have normal menstrual cycle. Yeah, but for some people, they just ease into it with minimal symptoms, and that's great. But that doesn't mean that during that period you are not, you are away from cardiovascular risk. They are escalating at that time.
Okay. Now, just now you mentioned that some of the women, when they are going through menopause, they will experience heart palpitation. Is that a sign of cardiovascular disease, the onset of it?
Right. So I do have many patients coming to me with palpitations. We see that as a common complaint in cardiac consult. But there's just so many reasons to make your heart race, right? When you're falling in love, when you're anxious. So fast heart rate can mean many things. Sometimes it can be physiological, like when you're exercising. It can be psychological, but it can definitely be a sign of organic heart disease happening. The commonest group of patients that I see complaining of fast heart rate are actually pregnant women. So I take care of pregnancy and heart disease as well. And actually that's physiological in pregnancy when the heart rate rises from about, say, second trimester and above. Because the heart demands are so high, trying to grow a little baby. Yes. But it can definitely be a sign of, say, heart failure or heart valve dysfunction. So it's good to have it checked out.
I think it's a good idea since you say, menopause actually increases our risk of heart diseases. Then we should start monitoring after we, start our menopause, right?
Yeah, but usually when we mean to start monitoring or getting aware, it's just basically being aware of any cardiac symptoms that is new for you. So it's not just a feeling of fast heart rate, but it may be chest discomfort, tightness, shortness of breath that is out of the usual. You find that you used to be able to walk one bus stop, but now I'm tired with half a bus stop distance. Or even giddiness, leg swelling. So there can be quite a number of telltale signs, not just heart rate alone.
Okay, yeah. But is there something that we can do, especially with the onset of menopause, to protect ourselves against this kind of risk later on?
Can.
Exercise. Correct. That's actually the answer to almost everything nowadays.
Yes, it's
Cancer
true.
prevention, heart disease prevention, stroke prevention. So
Okay.
yes. So when I ask my patients, do you exercise or not? And then some of them will think a bit, yes.
No, Dr. Loh, we are taking care of children, of family, of work, so we have no time, right?
I have been, I myself, I would think that very active in sports since young, represented schools in table tennis, in basketball, in badminton, in the various games. So I carry on that active lifestyle. Start like one bus stop earlier. Pay less bus fare also.
So talk more, walk more, okay, of moderate intensity. What else can we do?
Generally, it is quite important to screen for what we call cardiovascular risk factors. So that includes, in Chinese, they always say 三高 or in 3 highs. High blood pressure, high glucose, which means diabetes, and high cholesterol. And these are what we call shadow killers, because they are actually asymptomatic. At the beginning, and your first onset of symptoms may just be a heart attack or stroke.
Wow. Okay.
So it's important to screen for that yearly.
So when should we start screening?
I think for 45 is a great age to start.
Okay.
45 is a great. Most people start being able to find some time by then. For an annual checkup, and sometimes that goes with a ECG check as well, when they put electrodes on the chest.
Okay.
And just continue that every year.
Okay, on a yearly basis.
Yeah, from 45 years and above, or maybe even earlier for some people.
I think
who have
40.
menopause earlier.
40.
I started at 40.
Then
Then found out something major at the age of 43.
I see.
Oh, would you mind to share a little?
Nothing to do with heart disease.
Okay.
I had colon cancer.
Okay.
Oh, okay.
So I think good to encourage people to do health screening.
Yes.
I always believe in it. Yeah, so I think if we can start to have the health screening at 40, exercise, I would think that it has to be part and parcel of our life. It's don't wait until 40, then I want to start exercise also cannot. 心散了.
Some patients say like, oh doctor, now you diagnosed me with heart disease. Never mind, I just go like that. That's the best way to go, heart attack. But actually what people don't realize is, first of all, it's 80% preventable. Secondly, you don't just go like that. Usually there is a period where you will, it's of chronic disease where the symptoms can be disabling. You get impaired function, frequent hospitalization. And I think if you care for your family, you don't really want to have this burden of care loaded onto them.
Yeah, I think, if you come from that point of view, they might start thinking, I know I'm supposed to be the caring person, the caregiver. I don't want people to care for me. So they might start taking their health seriously. Now, so doctor, I'm curious, if let's say, we have done all this, hopefully we won't need to get to the point where, we experience a heart attack ourselves. But I think it's still good to know, all right, how does a heart attack feels like? Just in case lah,
Can I ask Hua Jie again, what do you think? How does a heart attack feels like to a woman?
Whenever I look at television, it's always
Yeah.
very painful.
It's always a man, right?
Yeah, and then also drama, right?
Yeah.
But that's why it's on TV lah. It has to be drama.
So is it like that?
But definitely for women, it can be in a much more muted version. So chest pain is the most predominant symptom. While it's the most common symptom, it may not be the most easily identifiable for women because sometimes there can be concomitant feelings of breathlessness or just lethargy, tiredness, or soreness in the neck, sometimes soreness down the arm. So when these things come together, they're like, it's not the chest pain that bothers them that much. It's just everything else. And there's a tendency to dismiss it. That, this is just stress, this is just, I'm just overworked and tired. And they don't seek consult easily because they are just not aware that symptoms of heart attack in females can be somewhat subtle. So that's something to look out for.
Can be giddiness also, right?
Oh yes. Lightheadedness, giddiness, nausea. Some people have cold sweats. Maybe it's just a bit of chest pain, but not the most, the biggest problem for them. So all these symptoms, if you are aware, just seek a consult early. Yeah, seek a consult.
Okay, right. So the other question I was going to ask is that, I recently read about our waistline measurements being, waistlines, all of us are covering our waistline. No, the waistline measurements, it can actually be a signal, or rather, be something that is correlated to our status of health, our heart health.
Yes.
Is it true?
Yes. So actually for ladies, even though we all like to have slim waistline, it's not just a beauty index. You know how it's always reported in all the pageants, right? The waistline is how many inches and so. But as I said, there is an important correlation to cardiovascular and metabolic health. So generally the waistline, we say for women, if it's 80 centimeters and above, that's not healthy. For men,
80
90
centimeter and above. Oh, go back, I must quickly.
In inches, maybe most people remember inches better, 31.5 inch.
31.5 inch. Huh?
80 and above. Wow,
Maybe I failed. Yeah, and it's not measuring the smallest part of your body, the hourglass part. It's actually around the abdomen at the level of the belly button. Exactly the spot where you tend to put on weight.
80 and above.
Between the lowest part of the rib and like the hip bone. So it's actually at the level of the belly button.
Right.
So not the smallest part, still lower down a bit. So that's it.
So you can push your fat further up.
Yeah. So, bigger waist circumference is been shown that it's associated with higher risk of, poorer cardiovascular outcomes. So we get people to exercise, have a good heart-healthy diet to keep the waistline down. That's actually
So if the waistline exceeded 80, what is the advice? How to reduce?
Yeah, so we take that as a risk factor, and amongst like the diagnosis of hypertension or diabetes or high cholesterol, these are all the risk factors that we try to address together. While I don't have a medication that says waistline, reduction, it is really still advocating for good exercise regime and healthy diet. But generally, with a heart-healthy kind of lifestyle, we can keep our waistline to reasonable standards.
The other thing is must be happy, 开心, yeah. I think the mood is important.
Yeah.
Definitely, as we talk about this, the health message is not to tell people to start worrying about their heart.
Yeah, not to worry.
And this is something I'm going to die of, I have to do something. So there are female patients I have who are very obsessed with their blood pressure and the cholesterol numbers and blood tests, and then keep looking.
It's quite stressful in itself, isn't it? Right?
Yeah. So don't. It's not important to have too much emotional energy worrying about it. Just get to action. Make conscious, good decisions when you are choosing food, and put exercise as part of a usual lifestyle regime. Have good amount of sleep, and taking things, and always on a light-hearted way, no pun intended. When it comes to managing mental stress, domestic issues, work, career, and generally just being very wholesome in that sense will have good, strong, healthy heart.
Okay, so we must hear from Dr. Loh also. So where food is concerned, do you have some tips for all of us?
Yeah, actually pretty difficult in Singapore because Singapore is food paradise.
Yeah.
Right? And then actually most of the food that we are proud of or we like and we call our local delicacy are actually
high fat, high salt and all that, right? Yeah, then it can be tasty enough,
So like things that we call low glycemic index food, so oats, brown rice, compared to white rice and white sugar. So generally these food choices are better, and less fatty meat, less butter. Actually, they're very common sense stuff.
Less fatty meats. 空把包真好吃。
So I think then maybe since we cannot give it up, so maybe we just do it in moderation. Not on a daily basis.
No, I tell you what people find they cannot stop. You know what? A lot of my old folks, who come and see what they like the set A.
Which is?
In the kaya toast. Set
So
A with
the
eggs.
and the butter.
And the butter, the goju
thick
in
butter.
the...
Oh my goodness, yeah.
So they like that and they can take that every day. So for elderly to maybe take 2 eggs every day with set A that is cheap and what they think is nutritious, it's actually quite high on the cholesterol content.
So even good things I must take in moderation.
But doctor, I take eggs every day. But not the set egg.
Not with the butter.
Don't add the kaya toast. But I take eggs every day. Can or not?
So maybe 2 a day is really too much after a certain age.
One a
when
day?
your
What's the
metabolism
line?
is coming.
1 a day?
I would say generally around 3 to 5 a week is alright.
For people in the menopause and beyond,
Post-menopause.
post-menopause.
Yeah.
So it sounds like it can be quite simple things that we can do, as long as we look out for those, simple food, stay away from them, don't take too much, and do a little bit of exercises. We can all start taking care of our heart health even from young. And better still, if you take care of it from young, then your waistline can also be slimmer. Correct?
Of course.
And you'll be a much better place when you reach menopause. Yeah, that's right.
So therein really lies the importance of having good heart health early on.
Okay, all right. Well, Dr. Loh, I've really learned so much today, hearing from you. So thank you for inviting us. But on a parting note, is there any nugget of wisdom that you can impart to ladies, whether young or old, on how they can protect their heart health?
Okay, I would just like to say that actually a woman's greatest strength lies in her heart. Guard it well, protect it well right from the start.
Yeah, I think, it's really true like what you say. Sometimes it just takes a little bit of ingenuity, just smaller things you can do, and you can actually be really actively looking out after yourself. And, in doing so, you're actually also protecting your family members. Otherwise, they'll be burdened with looking after you, right?
Yes, let's keep healthy and be happy. Don't forget about our heart.
Cheers to good health and good heart. Come.
Cheers.
Yeah, cheers.
Now we can finally eat the muffin.
So are they heart healthy?
Well, in moderation.
In moderation, yes, that's right.
My waistline exceeded already. Cannot eat. I think we skip.